Eosinophilic esophagitis, the 5 things you need to know. This article appeared in the Pediatric News Journal from the Academy of Pediatrics, and I just wanted to share the top highlights, the 5 things you need to know about it. So number 1 thing is that EOE prevalence is increasing, although not consistently around the globe. Apparently, it is more predominant in rural areas than city areas. And we really don't know why that is. So it's kind of a mystery. The second thing you need to know is that environmental and food exposures may trigger EOE or I can't even say it, eosinophilic esophagitis, and genetics probably play a role. They found that it was predominantly running in certain families, certain races, and in certain locations. Now, one interesting notice in this article is that they found that Helicobacter pylori or H. pylori infection is actually protective against EOE. So that's a very interesting thing because most doctors like to treat that with PPIs or proton pump inhibitors, and that is one of my no-nos to do. So it's good to know that the research is showing that H. pylori could be protective for people. The number 3 thing you need to know is that the diagnosis requires knowing the symptoms and excluding other disorders, as well as performing a biopsy. So this is not a very easy diagnosis to establish. Sometimes it takes 6 years or longer to establish, but the best cure rates have been found when people were diagnosed within 2 years of onset of symptoms. The number 4 thing to know is about treatment approaches, which are the 3 Ds: diet, drugs, and dilatation. So with the diet, we like to do an elimination diet, removing trigger foods that are commonly known. Even without allergy testing, we know what those foods are commonly causing the triggers, so we can just remove those 6 foods. We can give medication now. Since 2022, there's been a new set of medications that are monoclonal antibody based, and they seem to be showing promising results. And finally, dilatation, where this is a surgical procedure that needs to dilate the esophagus and stretch the scars. And the number 5 thing to know is that we want to reduce the diagnosis delays, because it is really crucial for limiting EOE-associated morbidities. So this goes without say, it's kind of a no-brainer, like we want to diagnose things as soon as possible, but it's not always possible. It really clenches on, the patients coming in, knowing what their history is, sharing their symptoms instead of trying to self-medicate with Pepcid AC or what have you over the counter, because that does cause a lot of delay in establishing a diagnosis. And it is a diagnosis that very few pediatricians will make, like myself, but it's mostly done jointly with a referral to a GI specialist. But it is important for PCPs or primary care pediatricians or physicians to be aware of this etiology or diagnosis, not to forget about it, because we are the gatekeepers, right? We're the ones who are going to be triaging and taking the history and establishing a foundation of when to refer the patient to the consultant. So I hope these 5 things are useful and promising to you, that you can start thinking, oh, do I have those symptoms? Should I maybe see a doctor about it? I encourage you to do so. I am not your doctor. I'm just on TikTok and Facebook and Instagram. So this is not meant to be diagnostic here. I'm just educating. So reach out to me if you have other questions. I'll be happy to answer, and I'm here to support you as always. Take care.